Good evening, everyone. Thank you so much for joining us for the webinar this evening. My name is Dr. Erin Hennessey, and I am a nurse practitioner. I am also the owner at Blush Aesthetics in Perrysburg, Ohio. And we really kind of have reached out to a lot of folks as to what types of topics they would like us to start putting out there a little bit more for folks that maybe don't have time to come in for a personalized consultation, but still want to learn about what options there are to treat some of their skin conditions. And the number one request we got was acne, which is not surprising. And so we wanted to get some information out. We also put out a survey to see when people wanted to come and talk about it, and in person, essentially. And what we found out is that people are really busy. Everyone had some different dates and times and weekend versus week. And so we wanted to put some information out that you could access at any time and that you could really access at your convenience. So I'm going to go ahead and get started. Tonight's topic is acne, and we're going to go over mostly acne treatments. We're going to show you some before and after pictures of those treatments that we utilize. That way you can kind of see for yourself what might be a good fit for you. So I'm going to start by showing a picture of me at 24 as a new mom, and I swore I would never show anyone this picture. I can't even tell you where I was psychologically at that time in my life, but I really don't have very many pictures of myself and my daughter at that age because I had some pretty severe adult acne. I had it in a very hormonal pattern along my chin and got some really bad breakouts while breastfeeding on my cheeks. And it was just really detrimental from a confidence standpoint. I just felt like I couldn't really look anybody in the eye at that point in time. I felt embarrassed of how I looked. You'd get a really bad breakout and you'd start feeling, very hopeless and helpless and depressed even. And you kind of would go to the pharmacy or you would go to Sephora and you would just hope to God that there was something on those shelves that would help you, that would solve the problem, that you just wouldn't have to deal with it anymore. And so I like showing this picture now. It was horribly embarrassing back then, but it just shows, how far you can come with the right treatment plan and with the right maintenance program. And although still it's hard to even look at these pictures anymore, I like to tell patients that, I once, went on this journey and I'm still going on this journey because acne really is a chronic manageable issue. So I've been where you are, and I've, sat looking through, Google and what solutions were out there. And so when I was at this time in graduate school, I really took a liking to dermatology and loved the topic. And that's really where I wanted my career to go. And I was very passionate about helping people who suffered these types of skin conditions, because I think we overlook how much of a psychological impact that skin disorders can have, specifically acne. It's on your face, and your face is the first thing you put forward every day in your life, whether it's at school or it's at work. I think that there are a lot of negative feelings about acne related to hygiene, which is really a misnomer. And so I always kind of like to tell folks I've been there, I've done this, and I'm here to help you through it. So we're going to kind of move along. So that cute little baby right there grew up, and she's 15 now. And luckily, she still enjoys taking pictures with me. Here's us on a hiking trip with SPF on, of course. So a little background about acne, and we're not going to get into this too much because I think there's a lot of information about acne out there, and everyone has kind of heard of what it is. If you have acne, no one has to tell you you have acne. Usually you're well aware that you have it. So acne is a common chronic skin condition involving the blockage or inflammation of the pilosebaceous unit. And that is a hair follicle with the accompanying sebaceous gland. So there's a lot of real estate in one little small area. And then there's also cells within that gland that flake off and that turnover. And so when we talk about cellular turnover in acne, we're really talking about making sure everything gets exfoliated so nothing gets blocked from that perspective, if that's one of the issues that's causing your acne. It can present as non-inflammatory lesions. They can be inflammatory and very large and very red and warm. Sometimes they even progress into an abscess as well. They can be a mixture of both, which is what most folks experience. And it usually affects the face, but it can also affect the back and the chest as well. So we're going to talk about some solutions that we have in our practice in Perrysburg. And I wanted to show you some before and after pictures, because what I find in consultation is people really want to see pictures of real people undergoing these types of treatments and what kind of results they got. So chemical peels, Oxygeneo, and silk peel dermal infusion are 3 of the tools that we reach for when someone has failed over-the-counter therapies. So let's say you have, tried any type of face wash, maybe that had some salicylic acid in it. Maybe you've tried Proactive and it just hasn't worked out. Perhaps you have even tried some of the over-counter spot treatments like the Neutrogena on the spot and just really haven't seen a result. One of the first things that we recommend, even if we're going to start an antibiotic therapy or we're going to start a topical therapy, is we want to kind of get everything moving on the skin. We want to exfoliate the skin. We want to make sure that we are allowing those breakouts to heal and that we are allowing anything that's brewing underneath the skin to start coming up. So this is one way that we do that. Chemical peels are used for aging. They're used for pigment issues like brown spots on the face. They're also used for acne. Same thing goes for Oxygeneo and silk peel dermal infusion. There's different aspects of each of these that we use for acne patients. They're also used for other things like anti-aging, which is wonderful. And sometimes we are combating wrinkles and acne at the same time, which I always say is, kind of torturous. Nobody should have to have acne and wrinkles at the same time. But if you do, we have solutions for you. So these are, 3 of the tools that we have that we reach for. This specific picture is a picture from Allergan and is a before and after of a Vitalize peel, which is one of the peels that we carry that we utilize for acne treatment. And I like this picture because it is a female patient who's 43 years old. And I think we traditionally think about acne as something that affects teenagers. We don't always think about the fact that it also affects grown-ups. And I would love to say that there is a time limit and an age limit to acne, but there really isn't. I see patients even into their 60s that are still having some breakouts. So, this was nice because it's not your traditional teenage acne. It's more cystic. It's more in a hormonal pattern. And this was really effective. So she had a series of 2 peels just to kind of get things up and moving, get on some good skincare, but really kind of jumpstart what she's doing. Forever Clear BBL is another tool that we have in our toolbox, and I love our Forever Clear BBL because it is very universal. We can use this on any age, we can use this on any skin color, we can use this on any ethnicity, and it does a great job at really minimizing the acne lesions that are there and preventing acne lesions from coming up in the future. For people who are very, very sensitive to acne treatments, it dries them out very quickly, or they just continue to break out more when they're on a topical treatment. Maybe they have a lot of allergies or just sensitive skin in general. This is the tool that I reach for. For people who just don't think they can be compliant with a topical regimen, and I hate to throw teenage boys under the bus here, but we treat a lot of teenage boys with this because as far as compliance goes, aside from being diligent about washing their face and maybe washing sports equipment, they just need to be present once a week for a series of 6 weeks of treatment for this type of a solution. So BBL or Forever Clear BBL. So we use Broadband Light or BBL for a lot of different things. Again, it's one of those tools where it has many different faces. But when we use the Forever Clear protocol, it's using light therapy to decrease bacteria, to calm inflammation and redness, and then just even that skin tone and the skin texture. I'm going to show some pictures of before and after. This is a picture of a female patient who came to us a couple of years ago, and she came after school with her mom for a consultation, and she said, I hate this. I just wish that I looked like I did, um, when my face is clear all the time. I feel like I covered up with makeup and it just makes it look worse. And I think we've all experienced that. If you've had acne that you've been trying to cover up, sometimes it just, looks worse. And she said, it wouldn't be so bad if I could just get rid of the pinkness of it. Once I have an acne lesion, I see, like a pink or purple spot there for months. And I think that's a very common situation among folks that have inflammatory acne. So we went ahead and we started a treatment that day with her. She hadn't been using a retinol or anything that sensitized her skin. She didn't have any tan on her skin, so she was a good candidate to start that day. And she sent me the after picture, which is the picture on the right, the next morning. And I always tell everybody, I cannot promise that this treatment is going to work overnight, that you're going to see improvement immediately. It's a stepwise process for sure. But she was absolutely thrilled the next morning, and she said, I know that you told me that you can't promise that I'll see any improvement. She goes, but I swear I woke up and I saw an improvement in my skin. So she's like, I took a picture and was wondering if you could send me the picture that you took yesterday so that I could put them side by side and take a look. And she did just that. And you can tell she kind of just woke up because she still has a bit of a pillow line, a sheet line on her cheek. But she was absolutely thrilled. And her results just kept getting better and better. And by the end of the 6 weeks, she was completely clear. And she still had just a little bit of scarring on her cheek that we went ahead and did some microneedling treatments on, and you can't even tell anything was there, which was wonderful. That was exactly her goal, and we were able to deliver that for her, which there's just nothing more gratifying than helping someone feel more confident at school and at their job and just in their everyday life. Here is another patient that was treated with Forever Clear BBL, and you can see she has a very typical teen acne pattern that's, I would call this relatively severe. She doesn't have cystic acne. She doesn't have the large cysts that accompany it, but it encompasses a decent percentage of her face. And so, we started talking earlier about, the washing sequence and making sure that you're, washing your face and being consistent with topicals. And that just wasn't really something that she was interested in. She had tried so many things before. And so, I remember hearing her story and thinking that there were so many teenagers just like that. She got an absolutely fantastic result. And these pictures, all of them that you will see are without makeup. So the before and after pictures are not makeup containing or using filters. In fact, some of them were taken before filters were really a thing. So here's another picture. And again, we talk about teenage acne a lot, but there are just as many women in their 20s, 30s, 40s, 50s, premenopausal and postmenopausal that are still getting acne breakouts. And I think that it's the most distressing patient I work with is the adult female with acne, because it's almost acceptable in their mind for teenagers to get acne, but they feel like, they're past that stage and they're professionals and they have to present themselves as such. And this is something that just is really bothersome to them. So she was absolutely thrilled with the decreased inflammation and the decrease in bacteria. She actually did have some eye makeup on in the first picture and doesn't in the second. But other than that, there is no makeup on in either of these pictures. And, now even looking back at this picture from the past, now we would also offer her microneedling or maybe halo to really help with some of that scarring that was on the lateral side of her cheek. But at that time, she was just being treated with BBL for the acne and had a fabulous result. Here's another picture that I like to show because I feel like there's a lot of women out there with this type of acne that just kind of pops up where it wants to, and it's not necessarily cystic and it's not pustular. It's just kind of inflammatory and feels like it's sitting under the skin, and sometimes they have some crusting and some bleeding that happens with it. And so that's another type of acne that we treat, certainly with the Forever Clear protocol. This is a very interesting picture because this is more isolated to the back. And I think we forget about acne on the body until it's time to do something where you are wearing a bathing suit or where you're wearing a dress that maybe exposes your back. I was just talking to a mom the other day who is very involved in her child's theater group. And the one girl found out that they had to wear a shirt that was a tank top on stage, and she about came unglued and said, we can't do that. It has to be a shirt that covers everything. And she just had very severe acne on her back that she was very self-conscious about. We get a lot of brides that want to wear the strapless dress, or they want to wear a dress that, exposes the back in some way, and they just say, I don't really know how to solve this. So, the first thing that we do when we see acne on the body is, we start out with an oxygeneo treatment to just kind of exfoliate that skin, because the skin on your body is much different than the skin on your face. And so it can tolerate a little bit more as far as exfoliating goes. And then we utilize the Forever Clear treatment just to really kind of calm all of those lesions down and kind of clear up and blend in some of that pink and purple spotting in there. Here is a picture before and after of a teenage boy, because I think it's really important to also put in, boy pictures. And I will say that it's probably a 50-50 split between boys and girls with acne. We see a little bit of both. So this is a male who had come in and it probably bothered his mother more than it bothered him, and was treated with the Forever Clear protocol. And this was actually at another follow-up appointment that he was getting a touch-up treatment about 6 months later. And you can see he kind of started having a breakout on his chin. And so he was like, one little breakout. And he's like, oh, no, I almost never get breakouts anymore. It's time for a touch-up. Here's another female who had some pretty significant cystic acne in her past and also was still having breakouts. So she had a combination of scarring and active acne that we were able to treat. And here is that picture again, just a little bit closer up of the before and after, because I want to kind of show, in this area right here is really where we're looking. And you can see how quickly it brings down the inflammatory process that's happening in that area. One of the other tools that we recently invested in that has quickly become a favorite last step in our acne protocol is our tripolar radiofrequency treatment. We've been using this on acne patients who may be a little bit more resistant to the treatment. So, once we get to about that second or third BBL treatment, we see how quickly things are clearing up. And if they say, I'm still having some texture issues, or I feel like, I need a little bit more to really help diminish some of those acne lesions that are a little bit larger or that have been there for a while. One thing that we do use is heat, and we use radiofrequency to get into that skin and kill off that deep bacteria that continues to cause breakouts. So this has become one of our favorite closing tools, where if we have folks that have a lot of cystic acne, not necessarily some of the superficial acne, but some of the cystic acne. And so we've been adding this on, having really good results with it. So we'd be remiss to talk about acne without talking about the scarring that sometimes is a result of that. And scarring can be just as bad as acne for some people, as far as the effect on the psychological well-being, where, they say, okay, I was going to be so happy when my acne stopped flaring, and now, all I see is skin that is scarred. And I think it's, it's a reminder of, painful times for them. And it's a reminder that there was something there before that you were embarrassed of and that you didn't like. And now that change to the texture of the skin can be anxiety producing. And it, some people are like, now that I have the acne gone, I really just want my skin to look smoother, and I want the texture smoothed out. I want to be able to wear makeup and not see, kind of that reflection of all of the acne scars. And so we always promise improvement. We can improve that. I never promise that we can make it go away completely, but I can say that we have had some pretty impressive results with our halo, and some level with microneedling as well, usually in conjunction with halo. But there are people that will choose to do microneedling, do a series package of 4 or 5 microneedling treatments, if they don't want to necessarily have the downtime that comes with halo, which is really minimal. But you know, there are people out there that have jobs that, you know, they really can't have any peeling or any downtime. So we have tools for both. We have tools for the folks that say, I want the biggest improvement right now. I want to look at my skin in 4 or 5 days and see improvement. Then we reach for halo. Someone says, oh, we can spread it out over several months. You know, that's okay. That might work better for me. That's when we reach for microneedling. For this patient, she not only had some significant acne scarring and texture issues, but she also had some sunspots, some age spots, because this patient, like me, you know, back in the day, they would say, oh, go out in the sun. It improves your acne immensely. Or go in the tanning bed. And I cringe when I hear that, because that was something that was used, that was said, that was advice that was given back then. And now we know how much damage that the sun can do to the skin that's unprotected. And you know, as you know better, you do better. And so one of the ways that we can help both of those problems is with halo, and that was the tool that we reached for here. And this was one of our patients after one halo treatment, and she was thrilled with the results. So we definitely have some tools in our toolbox to help with scarring as well. Oral and topical medications. So we do utilize oral antibiotics for some acne, especially if nothing has really been tried yet other than over-the-counter therapies, and your head, you know, it's very flared, very painful. If we see signs of infection, you know, that's really when we reach for those antibiotics to say, okay, let's get everything calmed down for a little bit, get you started on a topical medication, and see how you do with that. Isotretinoin is a choice. It is an option. A lot of people will come to us and say, you know, before I get on any type of an Accutane therapy or, you know, any type of oral therapy, I want to try Forever Clear BBL. It's kind of my Hail Mary, kind of the last ditch effort before we throw in the towel and say, okay, we'll do Accutane. So we do get those patients. We do well with them as well. So even if it's a Hail Mary treatment, we're always happy to reach for that Forever Clear BBL and see what type of results we can get with that first. Monotherapy or just one topical medication isn't usually recommended for treating active acne. So we have to come at it really from 2 angles. And a lot of times that's either combining benzoyl peroxide with an antibiotic like clindamycin topically, something that helps with inflammation, and something with a retinol. And not all retinols are created equal. So prescription strength Retin-A, retinol that comes from companies like Skin Medica or Elastin, where it needs to be purchased through your doctor's office, definitely work much different and much more effectively than some of the things that you get off the shelf. I get a lot of folks that say, I tried this, you know, over-the-counter retinol. It made me red, it made me scabby, it made me scaly. I think I was allergic to it, or I think it might have gone bad. So people have had, you know, different reactions to over-the-counter retinols, but that doesn't mean that you can't be on a retinol therapy with the appropriate regimen, with the appropriate medication, and maybe some different things that we do with moisturizing before or after to just make it a more comfortable treatment for folks. We do have a blemish reducing spot treatment that we formulated at Blush that our teenage patients especially are loving. So it is a liquid that is in a glass container, and we have you just kind of roll it to combine the 2 medications that are in there, and then you apply it with a Q-tip at night. We have topical prescription medications that we use with our patients, and we also have insurance reimbursed or compounded medications. So this is one acne gel that we've compounded that has worked very, very well for some of our patients. When we can't find what we're looking for as far as a combination of medications, sometimes we just have to compound it ourselves. And so that's what we've done with some of our rosacea medications, acne medications, some different topicals that we use. So that's always an option as well. So general care, washing your face twice daily and after working out is very important. We tell our football players and our hockey players and our volleyball players, they're sweating, they're really hot, and then they get home and they don't wash their face or they don't shower, and then they just go to bed. You gotta wash your face. You gotta make sure that you're getting that bacteria off, that sweat off, and really just starting out new. Moisturizing. Moisture is kind of a very scary word for people with acne because they feel like they're so oily already that it's hard to help them understand why moisturizer is needed. And really, that's kind of the body's trigger to say, okay, we're finished producing oil because we have moisture down here. So you want a moisturizer that's going down and working at the level where it tells those sebaceous glands, hey, we're good. We have enough moisture. You can go ahead and slow down a little bit so that you don't get oily. So sometimes moisture is really one of the key factors in preventing that overproduction of sebum. Following treatment instructions is always really important. Something is not going to work that's sitting on your shelf and that you're not using. So just simply bringing home the medication or bringing home that topical and sitting it on maybe, next to your sink or in your shower isn't going to work if you're not putting it on. So part of what we do at Blush is we really want to know what your lifestyle looks like so that we can match you up with the appropriate treatment for you, and not just for your acne, but also for your life. A balanced diet with plenty of hydration, protein, vegetables is always going to be helpful. Anytime you're trying to cut down on an inflammatory process in your body, we try to stay away from sugars because we know they are inflammatory. Sanitizing sports equipment. This is really important for our football players and our hockey players and our lacrosse players. When you have a chin strap or a helmet that you're using every day and that you're sweating profusely in, borrow an alcohol swab from the trainer and just kind of clean it out. Or maybe you bring wipes from home that you can wipe that down with. So, wiping it after use and then storing it somewhere where it can get some air circulation and dry properly is very important. Keeping hands away from acne-prone areas. This seems like a no-brainer, and it really does. And we tell so many people. It used to be phones when the phone, now I'm dating myself, but when you have the phone against your skin and they would have breakouts in those areas. But it really is something that comes so naturally to you that you don't really think about. Like if you're sitting and reading and you have your hand on your chin and then you don't realize you're always breaking out in one area. So just making sure that we're washing our hands well before we're touching our face, and just trying to, in general, keep our hands away from our face or any areas of breakout is important. Hydration, water is going to be your best friend. I know that a lot of folks turn to Gatorade and some other things for electrolyte rehydration. And if you need that, I completely understand, but Gatorade is full of sugar. And so a lot of times we'll say, if you're going to use something like Gatorade or Powerade, mix it half and half with water so that you're not getting quite as much sugar. You're not getting, too much of that. Sunscreen. I feel like I preach this all the time. I hope it doesn't fall on deaf ears, but sunscreen is really important when you're out and you're running or you're enjoying anything with athletics. If you are in the marching band, if you are somebody that works outside for your job, if you drive to school or drive to work every day, you're getting sun exposure. And so protecting your skin from that sun is really, really important. So if you think about it, if you have a 20-minute drive to work every day and you're not using sunscreen, you're getting about 40 minutes of sun exposure on any given day without protection. And so for people who say, I'm really never outside, I usually ask, are you in your car? Because you are going to get some sun exposure from that. So sunscreen is really important for people who have acne. I usually recommend a zinc oxide or titanium dioxide. Those are physical blocks as opposed to chemical blocks and tend to work really, really well. So that is the end of our presentation on acne treatments and results. And if you would like to come in for a private consultation with us, we're always happy to do that. We never charge for our consultations, and we will come up with a good regimen for you that works for your life, that works for your acne, that's effective, that we can, kind of build on and create some improvements so that you can feel more confident moving forward, and you can feel confident talking to people. In this day and age with, social interaction being so important, and I even know, a lot of folks with social media, they use filters for their pictures, but then you see someone in person and they look completely different without their filter. So we want to make sure that you feel confident at all times, not just when you're behind a computer. We're always happy to see you. Our phone number to make an appointment for a consultation is 419-873-5483. Again, it's 419-873-5483. Or you can reach us on our website at www.blushnwo.com. We have some videos there. We have some patient testimonials that we've linked up to. And it's just some good information about who we are and what we do, and a little bit about our background. So if you have any questions, please let me know. My personal email is Erin, ERIN, @blushnwo.com. And I'm always happy to hear from folks. And we can work together to get you to a place that you're happy with. So thank you very much for joining us tonight, and we hope you have a great weekend, and let us know if there's anything we can help you with. Thanks, guys.